Good morning. Making sure everybody's still awake. My name is Jonathon Feit, co-founder and chief executive beyond Lucid Technologies. Thank you for having me here. So Beyond Lucid Technologies makes the MEDIVIEW platform electronic patient care record and pre-hospital health information exchange. At the highest level, the 50,000-foot level, if you will, we ensure that information about we essentially connect ambulances and hospitals, making sure that information about a patient who has been involved in whatever gets to the care facility even before the patient does. And what makes us particularly unique in our market space is we actually were the first company in pre-hospital care to abstract what we refer to as the pre-hospital pipes, that middleware component of connecting the dots, and allow us to be layered onto any electronic patient care record system that U.S. national compliance requirements now in the market space, enabling essentially data from any pre-hospital care providing system to a receiving facility in as little as 30 seconds. On May 1st of this year, we crossed our 10-year anniversary. In that time, our partner clients, and we, by extension, have seen some events, some major events, both man-made and natural. And one of the things that we've learned in that space is that when something occurs, there are the big pieces that need to be moved around. There are the transportation logistics, the people logistics, the utility that need to be turned on or off, et cetera, the big emergency management decisions. But those decisions, especially where they impact people, can't be made without a sense of what's going on with those people. And that's the area in which we live. So ensuring that the information about the individuals who've been affected by whatever the disaster, the crisis, the emergency scenario is conveyed to the people who need to make decisions in light of the collection of micro decisions that ultimately lead to the macro. Next slide, please. And so this is, again, the area where we live. And the technologies that we've brought to market really are intended to facilitate what once was called EMS 2020, now has seemed to be kicked out to EMS 2050. We think it should be more like EMS 2019 third quarter. But nevertheless, it really comes down to a couple key pieces of a workflow in the pre-hospital space. One is the ability to capture information into a patient's care record system quickly, efficiently, with high integrity. The speed and integrity are really of the essence because you've got to be able to get that information captured now and conveyed now, where it can be not just a legal record, but something that has clinical value. If you convey an accurate clinical record to a caregiver after the patient's moved past the emergency department, for example, that clinical value is now clinical garbage. It may be a CYA document, but it does no good in terms of being able to make decisions about that information. And we heard a lot yesterday about the challenges involved in getting clinical information captured in an emergent environment, in an austere environment. Those are the areas in which we specialize. The second bit of that, again, the ability to get that information conveyed in real time and in useful fashion so that it can be consumed by an electronic health record, because your tax dollars and mine have already paid for standards of interoperability. So why reinvent the wheel? Why utilize proprietary technologies when we could utilize those standards in the most efficient way possible? The third is the ability to track that information across the healthcare system, be able to use that information, queue it back up, and be able to see not only where the patient has gone, but convey that information to other caregivers, the stakeholders in that patient's care who may need to have access to that information. Next slide. So what MEDIVIEW does, this is just sort of a high-level diagram of from the incident, even prior to the incident, capturing information all the way back from dispatch to the incident. And we heard about austere environments, remote environments, down into the middle of the city, and be able to convey information from dispatch into the vehicle, from the vehicle to the care facility, from the care facility back. Because while the public believes that emergency response is unidirectional, scoop and run, if you will, everyone in the pre-hospital care space, and most of the people in this room know that plenty of that information needs to go back. It needs to move around the system. There are other stakeholders in that information who need to use it not only for tracking patients over time, but for knowledge management, quality assurance, making sure that information gets where it needs to go, and that it's ready the next time a patient is seen, because the patients who come through the emergency response system are more likely than anyone to be seen again in that same system. Next slide, please. And the ability to make that information practical, again, is where we come in. events. So this is sort of a model, as you can see here, of the ability to have that information at the ready in real time has a real clinical impact. And we measure our company success along three key dimensions. Those are clinical, operational, and financial. So the ability, our job is not to make clinicians better at their job. They are the medical device in this scenario. But what our mission is to do is to ensure that they are informed of what is going on and ensure that information can be conveyed throughout the pre-hospital care system. So, for example, if you could, send triage information or registration information ahead of the emergency response vehicle, what if you could have a triage team or a patient's bracelet waiting for them when they got to the ambulance, instead of saying having 3, 5, possibly even as much as 8 minutes of registration time when the ambulance arrives at pre-hospital providers move into the ambulance bay, and they literally read off what they documented on paper into an electronic health record system. Bring out those inefficiencies. We kill fax machines for a living. And the opportunity to use more advanced technologies like biometrics and artificial intelligence to track patients over time and know who they are. It's core to our work. Closing this gap of 50% or so of patient data that's lost in each node of handoff in pre-hospital care. Next slide, please. We are in 26 states and 3 countries for our operations. Again, as a small team, it's something we're pretty proud of, with about 100 hospitals currently on our MEDIVIEW Beacon pre-hospital health information exchange network. Next slide, please. And again, apropos of the topic here of disaster response, one of the most important innovations we brought to market is the ability to modify the interfaces of the system, even down to the level of the individual provider. So you can go from the most basic buddy care, austere, get the person to safety environment. We were hired a number of years ago by Lockheed Martin to help consult on some battlefield triage technologies, where all you're making sure is that this person has all their appendages, their eyes, and who needs to know where to come pick them up through the most advanced critical care provider, both ground and air, where you're capturing everything from insurance information to ventilator settings and cabin pressures, and the ability to not only modify the interface experience by agency and role of care, but by individual provider. Next slide, please. I'm going to burn through some of these at the topic of templates, for example, for very rapid data entry that is correct and compliant to national and local standards. Next slide, please. Again, the ability to interface with any pre-hospital care providing documentation system and to share that information utilizing the clinical document architecture under the meaningful use framework with essentially any compliant electronic health record system. Next slide, please. I'm going to burn through these, capturing clinical data. Oh, we're going to have a clicker when I put these together. Telemedical data, including insurance and identity information, capturing signatures in any language, location information, and even to be able to use advanced interfaces such as handwriting recognition directly on the screen, so you don't even need to take out a keyboard because you're not necessarily going to have the time to do that. Voice to text is one of the most powerful tools brought to market. Next slide, please. Analytics. And just a quick overview of sort of where we are today. This is where we were about 3 years ago. Next slide, please. This is where we are today. So we've been 26 states under coverage. We have been called Silicon Valley's emergency medical technology experts, which we find very proud. Next slide, please. And it looks like everything didn't come through here, but happy to tell you more about our team, which again covers largely a focus on pre-hospital care, pre-hospital data, and government, essentially government information technology. Thank you so very much. Next slide, please. There's some contact information in case anyone wants to have a conversation with me. Thank you so much.